Hi and welcome to this fifth in our series of videos for frontline family violence workers and therapists. This is a collaboration between several agencies and individuals, and all the details can be found on the Centre for Excellence in Child and Family Welfare website. And as always, we'll be giving you a link to all the information and resources at the end of this video. First, we would like to acknowledge the traditional owners of country throughout Australia and recognise their continuing connection to lands, waters and communities. We would like to pay our respects to Aboriginal and Torres Strait Islander cultures and to elders both past and present. Now, those of you who've seen our previous videos will know that some of our country's top experts and some of our country's top experts' dogs have given up their time to help. And today, by popular demand, sees a return performance by four of our best. You've met them before, but I'm going to ask them to briefly introduce themselves again. So first we have Wendy Bunston hiding behind the mask. And, oh, is that Coco as well?
That's Coco. Yep, here she is.
Beautiful. Wendy, I'm going to ask you to take the mask off because we can't hear you so well with the mask on. So you're hiding your beauty and your voice.
Thank you, Nick. And this was not pre-prepared, what you just said. So yes, I meant to introduce myself, aren't I? Yes, so Coco, and I'm Wendy Bunston, and I am a free agent, apparently, and I work as a consultant, do some direct family work through a few of the programs that I consult to, and that's probably enough.
Thank you, Wendy. Kerry Arabina, welcome.
Hi everyone, my name's Kerry Arabina. I am a mother and a grandmother, and my grandmother came from Murray Island up in the Torres Straits. I am the Executive Director and Manager of First 1000 Days Australia, and been a social worker now for several decades and love doing the work.
Thank you, Kerry. Youngest looking grandmother we've ever had on a webinar, I reckon. Welcome to Helen Fithall.
Thanks, Nick. Hi, everybody. I'm Helen from Hobsons Bay City Council, Maternal and Child Health. And I've been doing maternal and child health now for over 12, 13 years. And I'm here to give you some information on the frontline workers in the maternal and child health area and how it is for us working with families.
Lovely. Thank you, Helen. And Kim Schroeder.
Hi everyone, I'm Kim Schroeder, Clinical Manager of Restoring Childhood at Berry Street that sits in Take 2 across the Northeast, Hume Moreland, Central Highlands and Mallee regions.
And my name is Nick Carr. I'm a GP writer and broadcaster. Now this whole project came about because of a recognition of the difficulties faced in this time of COVID for anyone who works with family violence. When it started, I don't think any of us had any idea where this pandemic was going to go in Australia. And now at the end of July 2020, we just had some horrible figures here in Victoria. We're in the midst of a pretty substantial second wave. And other states are obviously teetering on the edge, wondering what will happen next. So uncertainty is rife. So today we want to look at two main areas. One is what have we learned from the experience so far and what's changed with this second wave? And secondly, some practical ideas about not just how to help the workers with their families, but also how to help us look after ourselves. So let's begin by addressing the first question. And here I'm going to start with Wendy, and then I'm going to ask the panel just to discuss their experiences. So Wendy, when we think about the experiences so far, what's changed with this second wave, what are your thoughts?
Yeah, well, I guess the things that I'm going to speak to come from the role I have as a reflective supervisor to a number of agencies where they work on the front line with very at-risk families. And it's sort of thinking through some of the questions they've had and some of the things that I have noticed that the second lockdown has, I guess, robbed from the sector that we usually take for granted. So one of the things I wanted to sort of talk about was I've had a question around what's the impact of babies seeing face masks. That we've had some mums who are a bit worried about, is this going to have an impact on an infant's development in terms of not seeing the faces of others? And one of the things that I think is possibly the case is that babies are pretty quick to bounce back from things, as are young children. If they are given support, then they will bounce back fairly quickly. So I don't think it's particularly an area to worry about, because I think fundamentally babies will hopefully see the responsive faces of their primary caregivers, which will be their mum and dad, or mum and mum, dad or dad, and immediate family. So that's the main important faces that babies need to see. And if they go out with family and see other people with masks on, I don't think that will be something that we need to worry about as a sector. Probably talking about vulnerable families, the biggest worry will possibly be around seeing very depressed faces. And where there's deteriorating mental health for families where there are higher levels of vulnerability, then I think that will be the issue that will have the biggest impact. And I'm not going to, spend all the time taking up, and I wore this mask to sort of show that you can have some fun with masks. I won't try and take it off because I might look like some of the people that get it caught everywhere. But, some of the things that I guess are good to avert at the moment for the families we work with is their self-care as an important imperative to the self-care of their infant. And for some families that will be helpful. Some families, it might be just too overwhelming on top of everything else that they're trying to manage. So, intimately connected to our ability to support our clients, our clients that have babies and young children, and where there's potential level of risk is, at the moment, I think our potential to also support ourselves. I think there is a huge amount of worker fatigue at the moment. And I think that's come about partly because for people who are working at home, they're not really getting any incidental connectivity to their colleagues. They're pretty much spending their day going from one lot of work to the next. They're not having that workplace camaraderie. They're not having popping down to the shops for a coffee with their work colleagues, or going out to lunch, or popping into someone's office for a chat. All that sort of stuff that we probably don't even think about is a really important generative part of how we take care of ourselves. And I think workplaces need to think outside the box at the moment about how to keep some of the companionable parts, the fun parts, the spontaneity, the pleasure, discovery, fun, all the stuff that can happen in workplaces without it being planned. I think we have to plan for that. Yeah. So I might leave it at that and let someone else pop into that and see what they think.
Just to that, Wendy, and agree entirely about it's all been feeling like we're just stuck at home. You go from your kitchen table in the morning to your screen, back to your kitchen table, or, there's none, that sort of stuff. So what we've been looking at our workplace is having, again, it's more screen time, but having regular MS Teams meetings, but not necessarily meeting, we do talk about their day's work, but fun things about, just everyday sort of things. We had a bit of a mask off the other day when we had to all wear masks, and who had the best mask and all those sort of things. And so just trying to do that. And I was going to say, with the masks, the children, some of them are learning to do peekaboo. They talk about playing peekaboo with your mask, with your baby. It's me, it's mum or dad, put that back on and all. And I acknowledge that can be harder for someone who may be depressed and things, but just that might be some things to be able to say to some families. Sometimes with the lunch catch-ups, you can do that either on Teams or Zoom, but also organising maybe a one-on-one with another colleague, giving them extra time at their break to be able to go and meet up at a social distance at another centre or something like that. It doesn't mean you all have to catch up, but especially those nurses that are working in single nurse centres, or because the nurses have been coming back to the centre. So they're the sort of practical things we've been talking about, trying to help with morale out there for our workers. And I think they really want recognition from management too.
Yes,
especially the frontline workers.
They still have choices. We still have creativity. We still have the capacity to make things fun. So, we need to own that and start to take on board, okay, how do we make this more interesting, more fun? What are the things that are not what we traditionally do, but what we need to keep us energized and feeling looked after. And I think with that is we need to also sometimes ask for help and push back. We need to give pushback to managers who can do pushback to who they need to, because, you know, some of the funding bodies need to know that some places feel like they're drowning.
Yeah.
Yeah. So I've been, as a manager, I've been actually, sorry, Kim,
Sorry, go for it, Helen.
gone to up or above me to say, you know, can we get extra EAP, whether it be a one-on-one, which is funded, but even as a group. And so, yeah, it is thinking outside the square as to how we can help those individual, to help the workers out there. Sorry, Kim.
No, that's okay, Helen. I just thought it was a good time for me to chime in as a clinical manager and take some responsibility and accountability for exactly what you're talking about, Wendy, in that we have been mindful, especially of lockdown 2 for our northern team, especially in restoring childhood, that how difficult that is. And, you know, this is going on, the restrictions are going on a lot longer now than we thought they would. So the leadership team at Berry Take Two have thought, you know, really carefully about how we do support staff better. And so we are still encouraging face-to-face sessions with clients when it is safe. So there's obviously a risk and safety assessment and process that sits behind that. And we have been doing that across the regions, but we've also implemented things like a virtual lunch. So once a week, there's a virtual lunch. That's not compulsory. That's up to people if they, you know, if they feel like they're in the space to actually, you know, do a virtual lunch, they can. So there's some initiatives like that, but certainly we've increased EAP access as well. And I am fortunate that I do work with a bunch of therapists, so they're very good at being creative and innovative. And so they'll share not just obviously the challenges that they have within their weeks and their sessions, but also their, you know, magic moments. So they have magic moments where they talk about, you know, things that have happened with clients that wouldn't necessarily ordinarily in a therapeutic space. So where mums have shown, you know, around the house on the laptop and in the bedrooms and, you know, things that you wouldn't ordinarily see in that therapeutic space. So that's been really quite powerful to hear as well. But also that sharing, that personal sharing amongst colleagues as well within their homes. So a good example is obviously you sitting there, Wendy, with Coco. But as you heard earlier, that was Muppet guarding the house at the very beginning of the webinar. And mind you, I'll show you Muppet. Let me just show you Muppet. As you can see, she's ferocious.
Look, who's that? Who's a couple?
So that's Muppet. That was the big sound that you heard at the beginning of the webinar that put Nick off. So apologies for that. But yes, we romanticize working from home sometimes, I think, but there are plenty of challenges in that. But we get to see, I suppose, you know, my point with Muppet is that we do get to see parts of ourselves and our lives, our personal lives within our professional lives that we wouldn't ordinarily. Yeah. So there are some, you know, obviously mostly positives of that, but there are also some challenges around. Some staff don't have appropriate working spaces. So we've worked, again, very hard to support them to be able to come into the office, you know, social distancing with all the, you know, the hand sanitizer, the masks and all that sort of stuff. And, you know, we've sent masks out to staff, we've sent masks out to clients. You know, there's a lot of work that goes on behind the scenes to support staff and clients as best as possible in this space because it's difficult for all of us.
One of the things that I've been thinking about, there's a couple of approaches that I believe are really important, and you've already touched on some of them, but for managers, there are some fantastic training opportunities about how to exemplify remote leadership when you've got teams that are operating from different locations. Because I think also the management in our organisations have also been used to that face-to-face ideal in terms of the nature of work. That's been transformed quite a lot. So I think some of that remote area leadership and learning about how to do that would be really very powerful. And then the other things that I've started to do with our teams are actually paying for verdict chanting classes, just so that people get a chance to actually move out of their heads and into their bodies. Even online yoga classes might actually have a better outcome for people who are at home than going to a counselling session as such, because again, you can just stretch it out and elongate yourself. And also then just having some fun. So in order to help people realise that they've finished a week at work or they're about to start a week at work, we have reflective sessions the morning and in the afternoon where it's compulsory that everyone turns up. So none of this volunteering business, but then you have to reflect on what your week has been like and some of your amazing successes during that time. And then again on Monday, just talking about what the weekend was like and what kinds of goals have you set yourself for this week, so that we can actually just hear from people about whether these ideas of perfectionism or that the mental health anguish of not being able to do your work as effectively as you would like, and that social distancing, we're just trying to find ways of creating connection. And sometimes it's not around sitting and talking, it is around, well, chanting or doing Pilates together or something else, where people can be mute, but you've got still the visual of being connected is something that we're exploring, and it's having a really good impact. The other thing that we're doing is really mobilising through Facebook pages. So as other businesses are going into hibernation, we've actually ramped up our advertising and we're engaging with many more people in the hope that we can start to introduce next week, for example, reading online with an elder who will do a language book about creating online play groups. So at least there is a space then where practitioners can come together with families and share a similar experience. It's just through a different medium. And so they're the kinds of things that we're looking to bring online. And that came about as a result of talking with all of us at this last session, where I'd asked the question about, can we have playgroups online? And yes, it is that we can. Everyone has Facebook access, and so we can really start to mobilise through different Facebook pages that really help support us. The other thing that we have done too is to set up pop-up Facebook groups where you can just, it's a time limited session. So you have like a 5-day challenge and people then have specific projects to do or some creative activity to complete and those kinds of things. So we actually just help people move out of their heads into that heart space, but then really energize all of our systems so that you respond more effectively in different situations. So they're the kinds of things that we're trying, and nothing's perfect. And so we're really interested in taking massive imperfect action. But for those of us who really struggle with perfectionism, it's a tough time because we all thought it was going to be a sprint. And as it's turned out, it's actually a marathon. Yeah. So the strategies need to change. You know, when you're trained to run a sprint, you can do that for a period of time, but when you're doing a marathon, it is a different way of practicing and training yourself. And most of that is physical. So we're trying to introduce the physicality of who we are as humans into this therapeutic space as a way of engaging ourselves as practitioners, but also families and children.
I hear what
sorry.
Hear what you're saying, Kerry, because I attended one of the Restoring Childhood's team meetings last week, and I did notice that they'd changed their sort of background working environments. I think that was as a result of most of them, I mean, well, all of them are actually in lockdown too, and most of them were actually in the hotspots once upon a time. I think about 8 out of 10 of them were in the hotspots. And to begin with, when we, Zoomed into a team meeting, you would see in the background, it looked something like mine. It was, just a sort of plain wall, or, it might have been a study with a bookshelf or something like that. But last week, when I attended the Zoom meeting, you could see that there were doll houses, there were the TheraPlay puppets and toys. One of the clinicians had this, they call it Frankie, and it's a soft toy with a mask on as well, that they've been engaging with their clients and doing a lot of TheraPlay with their clients and a lot of dialogue sessions via Zoom. But also there was a bit of TheraPlay that happened within the team meeting.
Yes.
So really nice, and that was different. So when you talk about going from a sprint, I think, everyone went out immediately working from home, and we thought we'd be back in the office and face-to-face by now. And so we didn't, set up those environments.
Oh, Kim, we lost you.
We have.
Who have we lost?
Where'd you go, Kim? Where are you, Kim?
I can see her.
Yeah, I can see her.
Me?
There she is.
I think we still
There
have.
she is.
Yeah.
Oh, that was creative. How did you disappear? Woo!
Well, maybe it was my, you know, my bong that I was talking too much.
Your what?
Could have been.
Did you say bong?
Bong.
Okay. Okay.
COVID-19.
Okay. Yep.
Can I just add to this? And it's a little bit of it's a bit different what we're talking about. This is more about working with the families again. The difference, one of the things that's different with this lockdown to last lockdown from a maternal and child health point of view is that we are now seeing all young children from the 0 to 8. So this is just thinking about the workers that are out there, that if you, for instance, Kim, have got workers that would really like to be able to see a child and a family face to face, but there is the opportunity as ISEs, information sharing entities, or the MARAM training that we've all had, that the worker could make contact with their local maternal and child health area to see if they could coordinate and organise to have a session in the maternal and child health centre where they haven't got possibly a perpetrator or somebody there within the home. So that's just a practical, I was just thinking about, because that's that ongoing, how long are we going to be at home for? How long is this online face going to be going before we can get back to face? So that is an opportunity. So, and that's across the state. All maternal and child health centres are directed that they need to see, so they are working in the centres, they need to be able to see those babies. So that's just another opportunity to be able to see those families.
Yeah, absolutely. And Wendy, we are really concerned about the infants and the under 5s, aren't we?
Well, I think that there are some things that are happening that aren't great. And I think things happened differently in the first lockdown. So in what I'm hearing about in supervision, and there has been some things that have happened with babies that have not been good outcomes. So I think it is recognising, I think we still haven't seen everything that's going to happen in this round. There are families where the mental health of parents are deteriorating and there are increased risks. I think it would be naive not to say that there's an increased risk of events that are occurring within families. And, there's lots of difficulties for workers who might feel like there are, what we would call transference issues for working from home, where you're quite impacted by things, and normally you could leave things at work, but you're in your home space, and needing to come up with some ideas around perhaps setting clearer boundaries for yourself so that you have a disconnect from work to your personal life. And being able to sort of, as Helen said, draw on others. We need to work collectively as a community, I think, to be available to those families that are at risk. We also need to be gentle on ourselves because some things are happening that are scary, and, we can't prevent all of them. And that's incredibly sad and distressing. But I think we're trying to do the best that we can, and we need to recognise that this is going to go on longer than we think, and plan for that and be gentle on ourselves.
Yeah, we might have to come to terms with the fact that 50% of what it would be that we would normally consider to be our best practice, it may in fact be enough. And whether that's seeing 50% less clients so that you can go deep, or maintain that level of connection and really consolidate their experiences would be really important. But even 80% is probably only sustainable for a period of time before our own mental health deteriorates, and we have to take those times out. I spend some time in the garden. I pot plants if I can. I don't talk to my friends on the phone. I don't know why. It's very hard to reach out from time to time, but I do things that help me be creative, even if it's an adult colouring book. I've taken to colouring in again recently, just to get that big black voice out of my head that says that I'm not doing things well enough. So I just kind of disrupt it by playing and engaging in play myself. And I think that that's a really important thing. You know, here we are proposing therapeutic interventions based on play, and we don't actually do that for ourselves as adults. And that's what I love about how you've presented your screens there, Wendy. It's just full of beautiful little toys, and we can play ourselves. We can embody that and just release ourselves from this big adult experience for a moment. And that is a really good way to help people deal with uncertainty.
And you've made an important point there, I think, about not reaching out. I think that is something I notice amongst my friendship group, and I'm not reaching out as much as I used to. And I think it's something that our families are not doing either, because I think there is a malaise that's as a result of this. And whilst it's hard to, I guess, regenerate ourselves and not hard for our workplace, because I think we do a lot more sometimes for our workplace than we do for ourselves. But I guess there's something of our ability to keep reaching out to families. And I think Kim said it in one of the sessions where it was like, you don't have to do an hour a week. You might get up into a 10-minute phone call twice a week or 3 times a week, just so people know that they're being kept in mind, they're not forgotten. And I think that's really powerful for families. And I'm thinking of, you know, a group, the Peekaboo group that's being run with Berry Street at the moment, and one of the facilitators did this beautiful creative piece of work that they then dropped at the home of the family at the end of the group, the therapy group online, and I thought it was stunning. I got to see what it was, and I think the family would have been incredibly touched, and the little ones who were involved in the group. So that sort of stuff, I don't think you can underestimate how important that sort of going that extra mile, because when we do it for each other, we know that's pretty special. Our families need that too. And there's something generative about creating something that sort of says, I've thought of you, and this is what I've thought might be useful for you. And another person I know who started new work with a family, so they haven't actually physically met them, has been doing cooking with this particular a mum that's got a little one and there's lots of issues. And she's been ensuring that there's the ingredients left at the door each week, and they have a cooking session together. And what I've noticed over the weeks as this work has talked about her work is that the mum has started to include the baby in the Zoom sessions now. So she didn't to begin with, but now the baby's part of the cooking session, and slowly but surely she's beginning to open up, and she's able to now, you know, include the baby in the process. So just slowly, you know, doing some really great work.
And Wendy, that's a lovely, very practical example, and we've had a few, and in the relatively short time we've got left, can we focus on some of those practical examples of what people have learnt, whether it's for staff or for their families, about things that have actually worked well or haven't worked? What have we learnt over this last months?
So for me, Restoring Childhood and Peekaboo is being run up in the Central Highlands by Restoring Childhood, and they have you know, dropped off artwork and done cooking lessons, you know, virtually and both face to face. They've done yoga lessons as well, music, and, you know, dropped very tailored toys and equipment to families that then they can work with. So there's been a lot of, I suppose, there's been a lot of consideration and preparation that goes into sessions, so into that dyadic work with families, with a real focus on the therapeutic goals and interventions, which has been really nice to hear. So, you know, at one stage we thought maybe restoring childhood clinicians could see more clients because of the travel time, that they, you know, they didn't need to use the travel time in between within restrictions. But in actual fact, the prep time and the consideration time that, you know, goes into sessions means that in actual, you know, you keep the same sort of caseloads, but thought that goes into these sessions that once upon a time were more therapist led within the office, whereas now they're led by the, you know, parent and the child within the home. And we need to actually explain why we're all got something orange, because I don't usually sit here with a basketball in front of me.
Oh, come on, you do so.
I was wondering what that was actually, Kim, but that's a basketball, okay.
Basketball, Nick.
It's a basketball.
Yeah.
It's actually a celebration of orange joy. It's a safe place for everyone to be. So we've all got a little bit of orange around. Oh, look out, sleight of hand. The other day, though, what I got in the mail was surprising and it was delightful. I was delighted. And that was, I had a card from a friend and a handwritten note. And I cannot tell you that just doing something in handwriting, no matter what that looks like, whether it's a little drawing or something, and sending that off to our families and even just to other colleagues and staff, is amazing. And so there was Kerry #LoveBombHarrison, which was just a really lovely kind of thing to see coming through the mail, because you could appreciate that there would be so many people who would see that, and so just creating little positive messages for people all the way through. But just take the time out to send people cards or well wishes in handwritten things, and tell you it was truly beautiful. There's something about getting something in the mailbox which is a delight rather than a bill, which is just very, very powerful. Very powerful indeed.
Yeah, definitely.
Any other last practical tips from people before we have to close?
The only, I sort of think that creating a bit of a self-care buddy system is a good idea in workplaces, so that you actually have responsibility for checking in with somebody.
Yep.
So it's a planned idea. And I think, you know, it might be useful to, and this sounds depressing, so maybe I shouldn't say it, but it might be useful to sort of plan to be in this space till Christmas. To actually think about, we could be in a position like this for a little while. And rather than thinking it's, you know, each time it gets extended, or, you know, if we look at the numbers and they'll go down, then we're on the way out of this. I think we're here for a little while, and maybe it's good to plan for that and get staff and families and children's input into how we can make this as okay a journey as possible, given that we could be doing this for a little while.
The other thing that I'd really like to make an offering about is having every month you do a project of some kind. So again, just a different way of being able to bring people together. And it could be something like designing a different way of engaging people, or it could be a project around self-care for the month of August, or it could be a project around, because many of us, again, are really mapped into work processes, work themes. For the woman that I gave some advice to do some play, she had to schedule that in because it felt more comfortable for her to do that. So having monthly projects where you could do the online yoga courses, you can do playing a musical instrument online together, and having some kind of even TikTok. I know that I wouldn't use it personally, but they've got this thing where you can go through and you have a little makeup brush and you go through, and then people are all different looking and dancing traditionally, and those kinds of things coming out of the Tiwi Islands. There's a lot of different ways in which we can do projects that can really help build people's experiences and quality experiences over time. But I'd absolutely agree with Wendy. This is a marathon. We're not got a vaccine for at least 18 months. I've seen now that it's jumped into another species again over in the States, which is quite remarkable. And I think it will be around for a while.
That was a cheery ending.
No.
I just said Christmas.
Oh, no. Well,
18 months.
So if you're just cheering up everybody, take that smile off your face.
sorry.
Positive note.
You're nothing if a realist, Kerry.
Our dogs have been here for 60,000 years, so this is just
Good point. Good comeback.
Yeah.
Well done.
If we get out of it sooner, it's a bonus, isn't it, Kerry?
Yeah.
I think it is a very, very important point. People have talked about whether it's a sprint or a marathon. I've also heard it, the analogy that we've just finished one marathon and now been told to start another. So I fear, I'm afraid, that we will be in this for a long time. And I think taking a long-term view of it and planning for the long term is exactly the right way to go. Here's my one little tip that I have, all this sitting around not doing anything. I keep some weights, and so I can do a few triceps and biceps and so on, because otherwise we're just sitting and getting what we call chair bottom.
I didn't want to say that you looked more muscular,
Yeah,
but now that they've come out, yep.
But I think
be built by the time ISO's over.
So we've had some of our staff have been getting those nice balls to sit on, so they keep moving. So
my gym is just out here, and then one of my family members was out there before. I'm not sure if you saw, but anyway, that's my home gym.
I've got a colleague that every meeting she's just ordered a exercise bike, so she sits on it. And I was wondering the first meeting what she was doing, because she was sort of moving up and down. But yeah, she sits on the exercise bike every meeting, and so she'll be fit at the end of ISO.
Every day, every meeting.
Every day, every meeting. Yep. Wendy?
Yes.
Yeah, I know.
Yes,
I think I need to take a leaf out of her book.
Yes, I have had a few patients ask me on telehealth, why do I sound out of breath? And that's because I've just done 25 biceps curls. But we're going to have to stop there because that's all we've got time for today. So thank you, everyone, for joining us. And please stay online to give any feedback and leave questions that you would like addressed in future videos. And you'll also find a whole host of valuable resources available at this event page on the Centre for Excellence in Child and Family Welfare website. And that just leaves me to thank our wonderful experts who've given up their time to do this today. Wendy Bunston, thank you, Wendy.
Thank you.
Helen Fithall, Kerry Arabina, and Kim Schroeder. I've been Dr. Nick. Thanks for watching, and we look forward very much to having your company next time.